In the heart of the Federal Capital Territory, where the grandeur of the nation's capital shines, an insidious threat silently spreads. Diphtheria, a disease long forgotten, has resurfaced, fueled by a deadly nexus of ignorance, lack of access to healthcare, and deeply ingrained religious beliefs. In the special report, Correspondent Lois Abba Sambo cast a stark light on the urgent need for comprehensive interventions and a renewed commitment to education, healthcare access, and community engagement. Her report.
Diphtheria, a stealthy adversary that has plagued humanity for centuries. This bacterial infection, often forgotten amidst the world's pressing health challenges, has recently re-emerged in Nigeria, leaving healthcare professionals, communities, and families on high alert.
Diphtheria is a vaccine preventable disease, highly infectious, caused by the bacterium Correspondent diphtheria. It's actually a germ in layman words that's actually passed from person to person through respiratory droplets while coughing or sneezing. Symptoms actually starts at about 2 to 5 days after a susceptible individual is actually exposed to these bacteria. It could be as mild as things like fever, catarrh, sore throat. Then, in severe cases, we have toxins being produced by these bacteria, and these toxins actually lead to some form of grayish white patches at the back of the throat, and when accumulated in high quantity or volume, will actually lead to obstruction of the throat as well as the air passage, thereby leading to difficulty in breathing as well as swallowing. In severe cases as well, this toxin can equally pass into the bloodstream, affecting the nerves, the muscles, and even the heart, and can even cause some form of bleeding disorder or abnormalities. And in very severe cases, it could result in death. It's been reported that 1 in every 10 individuals infected with diphtheria will actually die.
The Nigeria Center for Disease Control and Prevention says over 800 cases of diphtheria have been confirmed in 8 states, including the FCT, with a total of 80 deaths, accounting for a case fatality rate of 10%.
We've had, sort of over 800 cases. The numbers, I say, you can confirm from the website. I think the important thing to note is what I said earlier. More than 70% of the cases are occurring in people that are aged 2 to 14 years old.
Tungam Wakili in Dei, a rural community in the Federal Capital Territory, has been devastated by a recent outbreak of diphtheria. The director, FCT Public Health Department, Dr. Sadiq Abdulrahman, announced the outbreak in the FCT.
We had one 4-year-old that died out of the 8 suspected cases, that we took the sample to NCDC NLR lab. And out of that 8, is only one came positive, and one also died.
I visited the family which lost the 4-year-old recorded by the FCT Public Health Department and discovered that they had actually lost 5 children within the space of 2 weeks. Reaching out to the FCT Public Health Department, I was told that only the 5th case was reported, as the other 4 children had died before the disease surveillance notification officer was alerted. For the sake of her identity, we will call her Nana Fatima. Nana Fatima is the eldest wife in this family. She says when they first noticed the fever in the children, they thought it was normal fever due to the change in season.
It started as fever, then they started throwing up. After some time, their throat started to ache. After 2 weeks, one side of their neck swelled up. After 2 days, both sides of the neck swelled up to the face. It did not stop after this. The neck and face kept swelling up. However, after some time, it subsided. Initially, 2 of them were taken to the hospital and they were placed on drip, but after that, it seemed like the situation got worse than the others, so we decided not to take the rest of the children to the hospital anymore. After 9 days, the first child died. 1 week later, the second child died. A day later, another one died. Between 12 days, the other also died.
In this community, a lack of knowledge about diphtheria and its transmission and their religious beliefs played a significant role in the escalation of the disease.
We left it to God because God has a plan for everything. God decides everything that will happen to us. If God has planned that this is your fate, there is nobody that can change it.
To me, I cannot say much because when I come to work, before I know, they say something like a gelter on the neck. Before you know, we heard that the children are dead, We won't ask a question, were they taken to hospital? They say sometimes it's not a hospital issue, so I have not much to say or to do. When I heard of it, I told the man, this is unusual, people, their way of life and their religion, they say it's just nature. So, I don't know.
Alhaji Mohammed Daudu is the Dakachi of Tungan Wakili. He says lack of access to a primary healthcare facility in the community also contributed to the rapid spread of the disease.
Because that we have a problem here, because this village, we're there for the center. The whole area, the roads by the side, the road everywhere. Now to cross and go hospital is very hard to them. Then that is how I'm pleading about to give us a clinic in this village.
With more cases of diphtheria recorded in the country, the House of Representatives has asked the Nigeria Center for Disease Control and Prevention and the Federal Ministry of Health to effectively contain the outbreak of diphtheria and reduce the fatality ratio in confirmed cases.
There has been a sporadic increase in the number of diphtheria cases in Nigeria since the beginning of the year 2023. The House further urges the Federal Ministry of Health and the Nigeria Center for Disease Control to intensify sensitization and enlightenment campaign so as to prevent and eradicate the scourge of diphtheria and other related diseases in Nigeria.
Vaccination has been the cornerstone of diphtheria prevention efforts, and with the recent outbreak, the FCT administration is upscaling its vaccination status to protect all children from diphtheria.
Anything from 2 to 14 years ago, they did not make use of opportunities to get vaccinated. Because if you are vaccinated according to our immunization schedule and you receive your 3 doses of the pentavalent vaccine, which contains anti-diphtheria toxin at 6, 10, and 14 weeks, then you are protected against diphtheria. Over 82% of confirmed cases are unvaccinated. Now, it doesn't mean that because people then were not vaccinated when they were younger, that they are now being ignored now. MPHCDA is conducted a vaccination campaign, okay? Other vaccines, but including a diphtheria antitoxin containing vaccine in the communities, at least the hotspots where these cases or this case was found. Please take all the children, infants under 2, take them to the health center. If they've not been vaccinated, let them start to catch up with vaccination. And that is the only thing to do to bring an end to current and future diphtheria outbreaks.
While progress has undoubtedly been made, the battle against diphtheria in Nigeria is far from over. It is important that health officials remain vigilant and the healthcare infrastructure is strengthened to improve access to healthcare and maintain high vaccination coverage to eradicate diphtheria. Lois Abba Sambo, ASO Television News.